So as you saw from that activity, not only are the words hard to define, but it can also be really challenging to determine what it looks like in the real world. That's because behaviors exist on a continuum. Nothing is black or white. So there's not often a clear distinction that separates normal from abnormal. Like, where do you draw the line from grieving for a loved one and experiencing depression, between being nervous or having an anxiety disorder? They also vary across cultures. There are individual differences with these types of things. So, what's normal for one religious group might seem abnormal to another. So you can see that these different kind of adjectives and behaviors range on a continuum from being normal and healthy, reacting to your environment, having some strugs, and something that you need to get help for. So this is a difficult topic, but scientists still try to find that line somewhere. We try to classify individuals with a mental health condition. So there are a couple different approaches that scientists use to try to draw this line. And the first we're going to talk about is the statistical approach. Now, we've seen this type of normal distribution a couple times now in lecture. So this is one way of classifying individuals. You might recognize it from the intelligence lecture. We use this to look at the average behavior in a population and then look at how much they deviate from the average. So the individuals in the tails, we talked about this in intelligence with the intellectual disability versus giftedness. The tails might tell you what is abnormal. So this is one way to kind of break down what might be separate from normal in a population. Do you think this seems like a reasonable approach to use? Do you think if we take the distribution across the population in the US, for instance, and find where everyone fits on this scale, that we could easily pull out the tails and that would tell us which individuals have disorders? What do you think about